So now what we're going to do is we're going to just look at internal family systems, and we're going to do a brief overview. Some of you may already know what internal family systems is. Some of you don't know what it is at all. That's okay. I'm going to give you just some key principles right now. It's called IFS in short, so that you can have a general sense of what I'm talking about. Again, this is not an internal family systems course per se. There are many different ways you can learn about that in different areas, and we'll be talking about that later. But for right now, let me just give you some key principles as we move forward here. So first, one of the things that's important around internal family systems is this concept that everybody has parts. We all have different parts of us. Internal family systems is a multiplicity of the mind, and it states that parts are normal aspects of our personality. That's kind of different. When I went to school way back when, as I told you before, parts were considered pathological. If you had parts, you had DID, or as they called it in the day, multiple personality disorder, right? And that was pathological and wrong, and we had to make you whole again. Internal family systems does not hold that belief. Everybody has parts. They all have important aspects of our personality, okay? And the other thing I'll say about internal family systems is systems, right? All of these different parts are organized around different systems, and we'll be talking about that later. But each system is a collection of parts, and each system or collection of parts tend to be organized around overwhelming life experiences or trauma, as we've been talking about. Now, the other thing about parts is all parts have good intentions. And this is something that kind of throws people. All parts have good intentions. Yes, suicidal parts. Yes, depressed parts. Yes, parts that show up as a panic attack or anxiety. The parts that cut. The parts that drink. The parts that shoot heroin. We believe that all parts have a positive intention. And that can be difficult for some people. Some people have a hard time with that. How could suicide have a positive intention? What we're looking at when we're looking at these different parts or aspects of the personality is the intention behind the part, not the effect it has on the body, on your partner, or at your work, right? We're always looking at the intention of the part, not the effect. Because in fact, when you focus on the effect, suicide is bad, or drinking causes trouble at work and destroys relationships, you shame parts. They feel bad when you point out the effect that they have. So we're always looking at the intention. Typically, I'll say, suicidal part or a cutting part, they're trying to protect from deeper pain, which is what we're going to be helping you find a different way to get to. So the intention of parts is always positive. So we're going to be talking about that, except under different circumstances, which comes back in a later module. So in general, all parts have a positive intention. Parts can show up as symptoms. So we don't think about diagnoses. We don't think about symptoms in IFS. We talk about parts. For those of you who remember the Inside Out movie that Pixar did years ago, that's what we're talking about when we're talking about parts. Joy, sadness, fear, anger, disgust, little people in your mind running around with positive intention. Now, when we look at the positive intention of all parts, we're going to break parts down into different categories. There are certain parts that protect. I'll tell you a little bit more about that. And there are other parts that carry wound or pain or trauma, okay? And the parts that protect come in two different categories: preventative parts and extreme or reactive parts. We'll talk a little bit more about that in a couple minutes. But again, parts that protect in two categories: one that's preventative and the other that's reactive or extreme. Okay? And then there is the parts that carry pain, the parts that carry wound, the parts that carry the trauma. So those protective parts work really, really hard. This is the positive intention in protecting the pain that we carry from our trauma. Next, we all have what's called self-energy. This is this concept that IFS calls self-energy. Different spiritual traditions, different psychotherapy modalities for that aspect call it something different. And we're going to really do a deeper dive around self-energy in our next module. But for right now, everybody has self-energy. And self-energy is different from parts. Okay, self-energy is different from parts, and I'll explain more about that. Overall, when we're looking at parts that protect, parts that carry wounds, and self-energy, the overall goal in internal family systems is that we get permission from the protective parts to access the parts that carry the pain. And if you remember, trauma blocks love, love heals trauma. That's what we're talking about. Trauma blocks love. Those protective parts block, prevent, and protect the pain. And we're going to help access through permission. We're going to get access from protective parts to access the wound and the pain. And we're going to use self-energy as healing energy. So that's the kind of overall way internal family systems works. And again, details in a later module. But for right now, let's just dive a little bit deeper into those preventative parts. I have to tell you, the languaging, Dick Schwartz, who's the founder of the Internal Family Systems model, 35 years or so ago, called these preventative parts managers. He called the extreme reactive parts firefighters. And he called those wounded parts exiles. I'm not crazy about that language, honestly. I think it's kind of weird. People will say when I'm working with them, I'm not a firefighter, I'm a school teacher. What the heck are you talking about, right? So I don't really like to use the languaging. It's just fine. But let me just talk a little bit about those protective parts. Two categories, remember, preventative and extreme. So we're looking at protectors right now a little deeper. Preventative parts are the parts of us that run our day-to-day life. They're hardworking. They're exhausted. They want relief. Some examples of preventative parts are the parts that want to please, the parts that caretake, the parts that obsess and worry over things, the parts that want to look good. Okay, these are parts that run day-to-day life. These, by the way, are the parts that love to take medicines. So for those of you who take medicines or have clients who like to take medicines, it's often the preventative parts like, oh, I'm exhausted. Oh, I'm so overwhelmed. Please give me some help. Give me some relief. So these are parts of us. We all have them. They have the agenda to work really hard to keep the pain away. And again, in internal family system, these parts are called managers. If you remember during our meditation, we were looking at thoughts, feelings, and physical sensations. And we were looking at the ways parts will show up. Some parts will show up in the body as a physical sensation. Some parts show up as emotion. Some parts show up as thoughts. So parts can show up in any number of different ways. Parts show up as symptoms, right? Anxiety, depression, things like that. So, but we are always looking at, is this part protecting? Does this part have a preventative nature? It works really, really hard to make sure things move smoothly and to make sure that those wounds stay hidden and don't get activated. So those are protective parts in the preventative nature. Now, let's look at those extreme parts. Now, these are the ones that it freaks everybody out. These are the ones that piss off therapists. These are the ones that get insurance companies all up in a tizzy. These are the reactive or extreme parts, okay? These are parts like cutting, yelling, raging, substance abuse, binging, purging, numbing out, dissociating. Yep, can be extreme in the activated sense or extreme in the shutdown, numbing, dissociating, suicidal thoughts or actions. So these extreme parts only show up once the wound has been activated. And that's a really important thing for people to be aware of, because we can have a little bit more compassion for these extreme parts instead of hate them when we know that the only reason they show up is once the wound has been activated. If you remember in the Inside Out movie, anger pushes down the button on the control panel. He gets really pissed off. His fire shoots out of his head. It's because the wound is triggered. Okay, so we're always aware that these extreme parts, which again, families don't like, insurance companies don't like, culture and society doesn't like, but they only show up when they feel like they have to. They have one thing and one thing only as their agenda: stop the pain. Stop the pain. Okay? So these are those extreme, or firefighters, as the internal family system model will call them. They show up to stop the pain. Now, that last category is wounded parts. Okay, and we're going to be talking more about wounded parts in our last module, but let me just say a little bit about them right now. The wounded parts tend to be young, but they're not only young, right? We can get wounded or hurt in any area of our life and in any stage or phase of our life. So we can carry pain at 60. I just went through the death of my father, which I will talk about later. There was a wound that kind of got developed during that process, but there was also wounds that got healed during that process. So we can have wounds at any stage of our life. Oftentimes with people who have relational trauma, or as we call complex PTSD, those wounds are typically young. And they are held in all different places in our body, in our bodies, in our emotions, sometimes in our thoughts and our distorted beliefs. I'm unlovable. I'm no good. Overwhelming emotion, right? When we're carrying something from being traumatized, or physically in the body. As Bessel van der Kolk says, the body keeps the score, right? So wounded parts can be in any area within our body. They can also be preverbal, believe it or not, that they don't have words, especially if somebody's been through something overwhelming before they have language, which is right typically before 2 years of age, when the hippocampus isn't even developed yet. You can't put words to your experience. Interestingly enough, I'm working with somebody right now who's working on intrauterine trauma. His birth mom was in a domestically abusive relationship, and he was hit in utero, and he's got so many physical problems. He never knew what they were related to, but as we kind of explore what's going on within his body, he has all of these visual memories and somatic memories about being hit in utero. So we can hold trauma even before we have words. Okay? Now, what we're going to talk about next is self-energy. I'm going to give you a little bit of an overview to summarize what I mean by self-energy, and we're going to dive much deeper into self-energy in the next module. But before we go to the next module, let me talk a little bit about this thing we call self-energy. Self-energy is different from parts. Some people call it our core, our soul. What we know about self-energy, it has internal wisdom or healing capacity. It has inherent healing capacity. When I'm working with a client and they're in self-energy, here's what I do. What's next? What happens next? What do we do now? I let go and I trust my client's system has inherent wisdom and healing capacity. It knows what needs to happen. So we, as therapists, are going to try to help our clients access self-energy so that we can really step back and let their system do what it naturally knows how to do. So that's what we call self-energy. Some people, and we're talking about this again, I'm super excited about it. Some people connect self-energy to source energy, to God, to Buddha, any number, Jesus, any number of whatever spiritual beliefs people have. So some people connect self-energy as source energy. Some people don't. Overall, I call self-energy a state of being. Okay? It's a state of being. It is connected to parasympathetic relaxation and withdrawal. People will do this. I really love that little boy. Do you feel the quality there? Yeah, I'm open. I know I've been avoiding this my whole life. It's time to help him. That's the quality of self-energy I'm talking about. Now, if you look at the model, if you look at IFS model, and every model has mnemonics, right? Because they want to make it easy for people to learn the model. There are the 8 C's of self-energy: curious, calm, courageous, creative, confident, connected, compassion, or clarity, right? Those are the 8 C's of self-energy. Now, here's what I want to say to everyone. Don't get hung up on the damn C words, okay? Self-energy is not a C word. It's a state of being, as I just explained. What ends up happening for people who are trying to grapple with this is self-energy. Are you curious? Are you calm? Are you creative? They get stuck on these C words. And then the clients typically will say, yeah, I'm curious. Yeah, I feel courageous. I'm calm. It doesn't work. That is not self-energy.